we've been hearing a lot about the mental health crisis, behavioral health crisis facing kids and teens across the country, in part as a result of the pandemic. What is the need you believe is not being met that you're trying to fill with technology?
Emily, thanks for having me. The need is a national, high quality, accessible, and affordable solution for families. So today, even pre-COVID, 1 in 5 kids had a diagnosable behavioral health condition, and 80% did not get appropriate treatment. And that's because historically care has been really hard to access and hard to pay for families.
So how does Brightline solve that problem and make sure that it's solving it with quality care?
Great question. We've built a care delivery system where we hire and manage our own team of pediatric trained coaches, therapists, psychiatrists, and speech language pathologists. We bring those services to insurance companies and we contract with those insurance companies to make sure the services are affordable to families. And then we provide those services virtually so that no matter where you sit in the country, you can access high quality behavioral health care for your kids. We've built this all through a model which has been proven and tested to be effective, and we measure clinical outcomes every single week for the children that are in our care.
How would you say the pandemic has exacerbated this crisis? You said 1 in 5 before the pandemic. What's that number now?
The incidence rates of pediatric anxiety and depression have both gone up about 30%. And there's new data that was just released last week by the CDC saying that 1 in 5 teens have considered committing suicide in the past year. So what we're seeing is across the country and frankly, even globally, a sharp increase in terms of the need and the severity level of pediatric behavioral health conditions. And again, that was building on already a point of crisis for the country. I think the other thing that we're seeing is an acute shortage of clinicians, and especially clinicians that are willing to be in network with insurance companies. And so the affordability crisis is real as well.
So with better access and better care, how do you think those numbers can change?
Yeah, we believe that there's no reason for kids all across the United States not to be able to receive care within a few short days of seeking care and treatment. Now, we have a long way to go as a country still working on stigma with parents and caregivers, but we're seeing actually stigma go down meaningfully amongst the new generation of children, adolescents, and teens. So that's good news. We're seeing actually a lot more openness. And so what we need to do is create affordable and high quality access. And that's really what Brightline is scaling across the country. The other thing that we think is critical is reducing the lack of equity and equitable access. Today, 75% of the counties in the United States don't have a single child or adolescent psychiatrist. And so one of the ways you reduce that lack of equity is by scaling using technology. So we've built a virtual solution to reach kids and families no matter where they are in the country.